Okay, so here is the respiratory system review for the lab final. So the first part is all on the skull, so if you want to go over that when you review with the skull, that will be good. So we're going to start with number 8 right there. So we have the superior nasal concha, the middle nasal concha, and the inferior nasal concha. So together, these are the nasal conchae. And they're also called the turbinate bones. And they're called this because when we breathe in air through our nose, it creates this circular motion of the air. So it is able to be filtered out better, moistened, and to the right temperature as well. So that is why those are there. We also have something called the external nares. So that is this part right here. So if you can think about the outside, we're looking on the in, but if you can think the outside right there, your external nares are exactly what you would think they would be, the part of your nose that you can move when you sniff. Then we also have internal nares. So that is right back here behind the nasal conchae. That's where that is. We also have the vestibula of the nose, and that is this area right inside the external nares. Okay, we also have sinuses here. And so this big one right here is your frontal sinus. And then this right here, along with this area here, are a part of the ethmoidal sinuses. And then this one right back here that has a B on it is the sphenoidal sinus. So we also have the maxillary sinus, which you can't see here. But if you can think back to the cadaver, we drilled a hole into one of them and we could stick our probe in a couple inches back. And so it's really big and it's just right in your maxilla. Okay, and then your oral cavity would be down here. This right here is your tongue. We have an nasopharynx, which is this part back here, an oral pharynx, which would be this part right here, and then a laryngopharynx would be this area down here. This little mark right there, that is showing the orifice of the auditory tubes. That's that circular part there. We also have adenoids, and these are the pharyngeal tonsils. That's shown right there in that yellow. The hard palate is this bony part right here. So when you put your tongue to the top of your mouth, the roof of your mouth, you can feel that hard palate up there. And then moving back, we go to the soft palate. This yellow thing that hangs down is your uvula. And so when you look in the back of your throat, the little thing that dangles down is that. We also have palatine tonsils, which is shown right here, that yellow mark there. And then we have the lingual tonsils, which is just right back here behind the tongue. So now we have a hyoid bone, and you can see that a little bit right here, that white part. And then we have what is called the epiglottis. So that is shown in this blue area right there. And so epi means above, so below the epiglottis we have the glottis. And so the glottis contains both the vocal cords and the spot, the hole between it. So it's this area. So the vocal cords are the little slits on the side, the little membrane flaps, tissue flaps, and then there's a little slit with a hole in between. So altogether that is the glottis, and then again the epiglottis up here. So the epiglottis, when we swallow food and water, this will cover the trachea, so we do not have that going down into our lungs. Okay, moving on to this right here. Okay, so we have the larynx. So the larynx is just this whole area right here. So it includes all this and the glottis, the vocal cords, everything. That is the area of the larynx. We have this up here, which is also the epiglottis, just shown in a different area, in a different way. So again, back here we have epiglottis there, and right here shown up there. This right here would again be the hyoid bone right there. Okay, so this blue part is what is shown as the thyroid cartilage. And so the thyroid cartilage is your Adam's apple. So when you think of Adam's apple, it is thyroid cartilage. So everyone has this. Some just have a more prominent thyroid cartilage than others. Down here, this blue part down here is called the cricoid cartilage. And so between here we have a ligament, and that is called the cricothyroid ligament. So that's that white part that kind of attaches the two there. Down here we see more blue, and so these are called C-shaped cartilage. And so back here you can see that it's just a C-shaped. It doesn't go all the way around. So that is why it's called C-shaped. And it's there to help keep the trachea open. So when we breathe in air, it doesn't collapse as easily. Okay, moving on to the lung here. So we have different parts of the lung. This part right here that you see is the trachea. So the trachea comes down, and then we have this area right here. And this is called the carina. It is anatomy's underpants right there, if you can see it. This is kind of a bad picture. I had to find one online. But I know there's a picture in with the ones that Dr. G put up. I just couldn't find it. So the esophagus comes down. Sorry, the trachea. When I said that, I knew that was wrong. The trachea comes down, and then we have the carina, and it splits off to the primary bronchi. So we have the right and left primary bronchi. Okay, and then again, going over the mucous membranes that we see, the serous membranes. So we have the visceral pleura, which would be directly on the lung right there, and then the parietal pleura, which would be on the rib cage that surrounds it. We have the base of the lung, which is down here, and then there's an apex that comes to a point, and that is right up here. That's called the apex of the lung. Okay, and then we have something called the costal surface. So if you think where the lung is in your body, most of it is surrounded by your ribs. And so most of this, so all of this area up front and on the side and towards the back, that would all be your costal surface of the lung. The mediastinal surface would be this inner part over here, the middle part where it goes towards the mediastinum. Okay, we also have what is called the hilum of the lung. So the hilum of the lung is right here, and this is where all of the blood vessels and the bronchi are coming in and out of the lung. Then we also have the root of the lung, which is this part that is right before it goes in. It's just that little root. It comes in, and then the part of the lung that it enters in is the hilum. Okay, then we have the different types of lobes. So as you can see, this is the right side and this is the left. The right side has 3 lungs where the left side only has 2, and that is because the heart is more on the left side. So because it's over here more, the right side can compensate and have an extra lobe to fill that space. And so we have the superior lobe, the middle lobe, and then the inferior lobe. And then over here we just have the superior and then the inferior. Okay, we also have what is called the cardiac notch, and this is this part right here. And so this is where the heart would sit, and so the left side has this little curved shaped part out of it, and that is what we call the cardiac notch. Okay, so this is all of the respiratory system. Again, if you have any questions on this or on any other units that we've gone over, just let me know and I can help you out. Send me a message through Canvas. Good luck, everyone.